not able to access doctors. And so they were passing prescriptions and sharing prescriptions. And we said, this has to stop. Like, we really needed to give people access to doctors, which is why the format of this is where everybody gets access to talk to a doctor. So that is one. And we will be continuing our Need of the Hour series till June 1st. Next week on our show, we have Dr. Newton. He is a past life regression therapist, and he's also a medical doctor. So he is an MBBS MD, and he will be sharing his insights about coping with grief and fear. After that, we have Minnie, who is going to be talking about the importance of breath at this absolutely important time, and how breath really focuses and can help us balance our mental and emotional energy. Then we've got on Wednesday, we have Dr. Vivek Nangia, who is obviously a head pulmonologist at Max, and he'll be joining us on Wednesday. Thursday, we have Dr. Vipul Gupta. He is a homeopath. He'll be joining us as well. And also closing our event, we've got Sister Shivani on the 1st of June. So the calendar will be out soon, and block your dates till then. The second thing we'd like to share is that now we are open for members.
And so just one second, Bhavna. Divya, Professor Arvind Kumar has joined in. If you can make him co-host, please, and unmute him and start his video. Yeah, he's already joined in. Continue,
wonderful.
Bhavna.
Thank you, Rinki. Thanks very much. So everybody, while we're waiting, this is a team effort, you know. We've been doing this on a daily basis at a marathon pace and bringing exceptional people. And now we can see you. Hi, Dr. Arvind Kumar.
Yeah, can you hear me now?
Yes.
Thank you.
Brilliant.
Thank you, Charu.
Thank you. And thank you so much, Doc, for, you know, persisting with us. Thanks a lot.
No, my apologies for this goof up. Hello. Hello.
No, Professor Kumar, you are audible now.
Bhavna, you have gone silent.
Yeah.
Yeah, Bhavna, your audio.
Hi, can you hear me?
Yes, now
yes, we can hear both of you now.
Okay. I think let's start, because before the technology troubles us again.
Yes, I think so, Doc. Okay, let's just head right into it. So, Doc, you have been treating, well, you are obviously a lung surgeon, and you've also been treating COVID. Doc, there seems to be so much contradiction right now in terms of the protocols. Some people are saying go aggressive right at the start. You know, even asymptomatic, they're saying, okay, start with the antibiotics, give the doxy, give the ivermectin, give everything. And a lot of people are just starting with if you have comorbidities, they're saying start with the steroids straight away. A lot of other people are saying wait till day 5 before you start steroids, you know, and there's logic behind both, I think, right? One is just an aggressive line, and the other says, no, let's just wait. What do you think is the right protocol?
Okay, thank you for that brilliant question. Answer is actually very simple. I don't think there is so much confusion. So we divide this disease into 3 categories: mild, moderate, severe. Right. Mild is when you have fever and your respiratory rate is within normal range, which is about 18 to 20, less than 24. Your saturation is above 94. That's what is mild disease. If your saturation ever drops below 94 but is above 90, and your respiratory rate is above 24 but below 30, that's right, when you are tending to have lung involvement effects, and that's what is called moderate disease. If your respiratory rate is more than 30, your saturation is less than 90, you are termed as severe disease. So good news is that majority of the patient, 85 to 90% of the patients will be in the mild category, and about 10 to 15% will go to moderate, and about 5% will require admission to ICU, and half of them will require ventilator. That's how it divides. So those who need ventilator is a very small number, and those who go on ventilator, some of them will come out, some of them will not. And if you take return to home, over 98% of the people will return home, right? So mortality has been generally overall in the range of about 1.4, 1.5. Let's take a figure of 1.5%, which means over 98% of patients will come back home alive. When you have mild disease, it's a viral disease and it is to be treated as a viral disease. So typically this disease takes two kind of courses. First 5 to 7 days is a period of fever with various other symptoms. Now, one very important message I want to give now is that unlike last year where fever was the main complaint, this year this disease has been presenting in weird ways. So, some kind of a sore throat, running nose, red eyes, headache, body ache, backache, joint ache, muscle ache, nausea, vomiting, diarrhea, rashes on the body, no fever. This is how. One of my own colleagues on Monday morning came and said that last night I was having severe diarrhea. I said, oh, go get your RT-PCR tested. He said, sir, what are you talking? I was having diarrhea. Maybe there was some food. I said, no, I insisted. He went and got the RT-PCR done and it was positive.
Yeah.
So first thing I want to tell you is that in this context, today's second wave with the kind of load of disease that we have, any of these symptoms developing should be taken as COVID, even if proved otherwise. Normally you say take it as COVID unless proved otherwise. I would say even if proved otherwise. Why I'm saying that? The moment you have these symptoms, the first response from you should be to isolate yourself in a separate room, home isolation. RT-PCR can be done later because RT-PCR may take a day or two to do depending on how well connected you are. It will take a day or two for the report to come. If you keep mixing in the society, कि मैं तो तब मानूंगी जब RT-PCR positive आएगा, 3-4 days you've been roaming around as COVID positive and then you get the report. By then you might have infected dozens of people, including your family members. So first response today is to isolate. Then do RT-PCR. RT-PCR may be negative in about 30% of the cases. False negative because of various reasons. So if symptoms are suggestive, even a negative RT-PCR is to be treated with COVID protocol for about 10 days. So this is one very important message because if we don't pay attention to this, we will continue to transmit disease to other people. Second thing, 90% of the people will be in the mild category who need mainly paracetamol to control their fever. Paracetamol, usually people write SOS, which means take it when you have fever. I keep saying take it regularly, 6 hourly, if needed 4 hourly. The next comes the dose of FabiFlu. Now FabiFlu is an antiviral. All the studies which have been done, there is no study which has categorically shown a better outcome by giving this disease. There is a very, very soft data about this drug, and that is why the ICMR AIMS guidelines which came out in April, which came out again on 3rd of May, and the last ones which came on 17th May do not mention this. So if your doctor writes now, please let me make it clear that whatever I'm giving here is not a prescription, it's an advice based on my experience. There could be difference of opinion. So if your doctor says, no, I want to give it, please don't argue with him. If he's your treating doctor, please follow him. But I want to say that there is no solid evidence available to prove that giving FabiFlu makes a difference in the outcome. Next comes antibiotics. Now, this is a viral disease which is caused by virus. Antibiotics are active against bacteria. So you give azithromycin, you give amoxicillin, you give doxycycline. It makes no difference to the outcome of the viral infection. Some people say that there may be some secondary infection. So if you give it with that angle, you are going to kill the nice bacteria, allowing the resistant bacteria. So second week, if the person does get an infection, he will need higher antibiotics. So I don't prescribe it. And when I had COVID 6 weeks back, I neither took FabiFlu nor azithromycin nor doxycycline. I only took paracetamol. And of course, I took ivermectin. Why am I mentioning ivermectin? Again, for ivermectin also, there is very soft data available. It's not a hard data, but there is some data. There was a study in AIIMS Bhubaneswar, and then there are a couple of other studies in the country and outside, which showed some benefit. It is an antiviral. It goes into the cell and it stops the replication of the cell. The reason why AIIMS and ICMR guidelines have continued to mention it is it's a very safe medicine. It's a cheap medicine, hardly any side effect, and it just needs to be taken 1 tablet at bedtime for 5 days. So therefore, the current AIIMS guidelines mention it, and I believe in it, and I took it. Right. So that leaves us with paracetamol, ivermectin. Only
Yeah.
two things. Vitamins is your choice. Nobody has again shown that giving zinc, giving vitamin C, giving vitamin D makes any difference to you. It does make a difference to the companies. And therefore, it is not mandatory to take it. But
Yeah.
more than medicines, what is most important, which most of the people don't talk about and don't mention, is two more M's. So first M is don't mix. The moment you have symptoms, don't mix. That's the first M.
Yeah. So
Second M is
isolate. Yeah.
second, isolate. Second M is medicines. Now, third very important M is meals, which nobody talks about. It's a viral illness. It's a very bad illness which affects every system of the body. You need to take high protein diet. You need to take low calorie. You don't have to eat a lot of sweets, because if your sugars are high, it actually supports the virus. You should keep fat also low, mainly proteins, which comes in non-veg food, eggs, paneer, dal and soya bean and milk product. These are the sources of protein. We must take these proteins, lots of fresh fruits. Don't smoke at all, don't drink at all, because all these decrease your immunity. So that's about the meal. Most of the people are not able to eat big meals. So I keep saying, keep a plate of some eatable next to you and keep eating something every hour, so that from 6 a.m. to 10 p.m. your total intake is in a good amount. So that's very important.
Small frequent meals, and it's also less
frequent.
Taxing, you feel. Yeah.
And it's also good for the stomach, because there is always an associated gastritis, and if you keep feeding something to the stomach every hour, it keeps your acid also in control.
Low.
Otherwise, if you take a big meal, 2 hours after the big meal, there is a surge in the acid. So this all. And the fourth M, which is very important, is mindset. Today, Corona means ki Yamraj ka invitation aa gaya. You know, so much of panic, so much of news, so much of WhatsApp university degrees and messages.
we're all graduates.
When you are panicked, when you are tense, when you are very anxious, nervous, you have a lot of adrenaline being secreted. Now that adrenaline keeps your body in almost like a gadi being in first gear. Imagine driving a car for 100 kilometers in first gear. What will happen to that? So imagine keeping yourself in 7 days of isolation in the first week with being tense, anxious, nervous, apprehensive all the time. You are actually burning your body. So most important is to calm down. And therefore, I have been telling people breathing exercises, take a deep breath in, hold it for as long as you can and relax. When you do that, the body relaxes. If you do it a couple of times every hour, it relaxes you. Talk to people, listen to music, bhajan, do puja, do your hobbies, whatever, but please don't see too much of TV and please don't worry about it. Keep telling your mind that 98% of the patient will get well and I'm going to be 98%. This positive thinking, Bhavna, is vital because
I think you're absolutely right, Doc.
It will keep your hormones low. So this was fourth M, mindset. Next, very important M is monitoring. You need to monitor your temperature. You need to monitor your saturation. So we say use the probe correctly. Put the probe properly inside. Let it settle for a minute to minute and a half and then take the reading. If you put it immediately take the reading, it may be very low. And next, you have to monitor the breathing rate. If you are doing breath holding and you are increasing your breath holding time every day, which I'm very passionate about, then if it's 30 seconds plus, you are in a very safe green zone. But if suddenly it decreases, that shows that there is some problem. There's another beautiful test called 6-minute walk test, where you check your saturation, remove the probe, walk for 6 minutes in your room and come back and put the saturation and see if there is a fall. If there is no fall, that means your lungs are able to take increased load also, which means everything is good. So an increasing breath holding time and no fall on 6-minute walk test are two messages from your lungs that everything is good. So this monitoring should lead you to last M, that is movement to hospital. If you find a drop in saturation, if you find persistent temperature, especially beyond first week, if you find any alteration in sensorium, excessive cough, excessive chest pain, which typically occurs towards the end of first week, then this is the time to get for the blood test, for the CT scan, and move to the hospital. Otherwise, in a typical uncomplicated first 7 days, there is no role of steroids, there is no role of blood thinners. In fact, using steroids during this period, or if I may use the word misusing steroids, is one of the reasons which is leading to back fungus.
No, absolutely. And in fact, that's the whole point, doc, because people are taking steroids and then they're finding that their immunity is getting suppressed. They're fine for 4 or 5 days. They're symptomatically they're better. So on clinically also you observe them, you think they're better. And suddenly, boom, again, they've got fever or they've got a cough. And now that's when I guess the time is to start your antibiotics for the bacterial, right?
So steroids are the things which give you a false sense of well-being. So
Yeah.
if you take steroids, your fever will come down because fever is a normal response of the body and steroids blunt that response. So Joe, what is supposed to happen normally, you are artificially preventing it from happening. And mind you, the first week is the time when virus is multiplying in your body. And
Absolutely.
if you give steroids and you bring the lower immunity down, you are actually giving a more fertile ground to the virus.
Yeah, it's going to thrive.
Absolutely.
Yeah,
So
it's going to thrive.
It's to me, let me use the word, it's criminal to be using steroids in an uncomplicated, straightforward first week course of a mild disease. Babu.
Thank you, Doc. Doc, I have a question. Now, there is so much debate. Everybody's taking Ecosporin and Ecosprin, and they're all saying, this is the blood thinner, but it's really not the anticoagulant that you need. And people are saying that needs to really be taken for 3 weeks, not the 10 days that are with the steroids, right? So can you explain that a little bit? And why is one not the other? And why are people just taking one?
So during the first week of a mild disease, there is no role of steroids, there is no role of blood thinners, and to me, there is no role of antibiotics. It's a straightforward paracetamol, and if you believe in it, ivermectin. But meals, mindset, positive thinking, monitoring, these are most important. And as I said, red flag signs usually appear towards the end of the first week. Typically, lung involvement manifests beyond 8th day. 8 to 14 days the time when lung involvement manifests. So a fever persisting beyond 7-8 days should be taken as a red flag sign. When you go to moderate and severe disease, now these are the cases where steroids are indicated, and it has been seen that these cases usually have an elevated D-dimer and other things going in the body. So they have a higher tendency for coagulation. And that is why these people, when they are in the hospital, they are given injectable anticoagulants, blood thinners. And when the patients are discharged, we discharge them on some oral blood thinners, which typically they should take for 10 to 15 days after discharge, unless the patient has been in the ICU, etc., in which, or he has had some clinically manifest coagulation problem, clotting problem. Some stroke or some clotting demonstrated, in which case they need to take these for about 3 to 6 months.
Okay, Doc. So, Doc, the other thing is that, there is so much debate because everybody's saying the patches that you see on a HRCT. So they're saying, oh, these patches. Now, is it pneumonia patches? Are these bacterial patches? Are they indeed masking and then showing some elements of clots? I mean, there's so much, misinformation. I need clarity.
Okay, so typically clots do not cause patches unless is a big clot in an artery, where apart from patch, it will cause numerous other problems also. Otherwise, these are picked up on CT angiogram and you don't see them on the chest X-ray. You may see them on the CE, contrast CT scan. Otherwise, you don't pick up patches due to clots on the chest X-ray. So when you have patches seen on chest X-ray in a setting of COVID, these are viral pneumonias where it occurs. Now, one thing I may clarify, which is again will be sort of shocking to everybody, these pneumonia patches are not due to virus. Virus causes immune response to start. In some people, the immune response goes haywire. It goes very exaggerated, and we give it a name cytokine storm, in which a lot of chemicals are released in the body. And in these people who have cytokine storms, these chemicals go and cause damage to the lung. So by the time you start manifesting these patches in the lung, the virus has gone. It is your chemicals which are causing injury to the lung. And these are typical viral pneumonia patches. Some of these patients in the subsequent week or 10 days, may develop super added bacterial infection or
Infections.
fungal infection also. But typically from the end of first week to the end of second week is the time when viral pneumonia patches are seen. And they could vary from, no patch to the entire lung being white. That's how we define the CT severity score. Bhavna.
Okay, wonderful, Doc. So, Doc, I'm just gonna, okay, black fungus. Now we've got white fungus. What is this white fungus? I mean, like black wasn't bad enough, Doc.
So we have these various bacteria, various viruses, various fungi present in the air that we breathe, present in the soil, and also present in dirty water, and also present in surfaces and dust, etc., all around. When we breathe, all of them go inside our lungs, but they come out. They're not able to get a foothold there because of the good immunity that we all have. In COVID, and particularly in diabetic patients, because of the effect of diabetes, which decreases the immunity, and because of the heavy dosages of steroids given for a long period of time, which further throws the diabetes haywire. So the two together kind of kill the immunity completely. On top of that, if you are getting oxygen and oxygen for a long time, which is coming through a humidifier chamber, right? And by chance, if the chamber or the tubing is not being cleaned and there are some fungus present there also, that fungus enters your body. So it could enter from the air also, and it could be exaggerated because of the humidifier chamber not being clean. Either way, these fungi enter your nose, and now they find a fertile ground by virtue of your lower immunity. So they find a foothold in the nose, and then they spread to various parts of the body. So black fungus or mucor is the most deadly one, but the other one which is coming now is white fungus. Neither is the black fungus black, nor is the white fungus white. So one is called mucormycosis, other is called aspergillosis. So these are all different forms of fungus which are present in the nature, and they have to be treated. The mucor is a really deadly one because it spreads very fast.
But Doc, what can we all do to safeguard ourselves and prevent it?
What's important is to not misuse steroids. Bhavna, I said lot of people, my own sister who's a doctor in Meerut had COVID. On the day one of her mild illness, she was given a depot injection of steroid. And I scolded her, why the hell did you take this? But her treating doctor gave it. So a lot of people are using steroids because it gives you a sense of well-being. Patient says, Doctor, mujhe to bahut acha lag raha hai. So it's immediate gratification, but it's a slow poison.
It's a false sense of security, Doc.
Absolutely. It's a false sense of security with poisoning. It's a
poisoning, Yes. So actually, like you said, instant gratification.
Controlling your diabetes, keeping your mindset well, positive thinking, not being anxious. I'm repeatedly highlighting the value of not being panicked, anxious, tense, because this decreases your immunity. It increases the chances of your going into moderate and severe.
No, and like you said, Doc, your statistic is brilliant. If anybody needs hope, that's the stat. 98% recover. So I think, you've really inspired everyone and given hope here. Doc, I'm going to open the floor now to questions. Is that okay with you? Because I know we lost a little bit of time, and we're just going to start taking audience questions. Okay. Hi, Doc from Glossy. What are the changes in the lungs as part of the long-term effect of COVID if the HRCT score happens to be above 15/25? That's a good question.
That's a very important question, and actually I wanted that question to come. I have circulated this video on breathing exercises. Trust me, that video has done good to lots and lots of people. Two reasons. One, it is giving you something to achieve, and improve your lung capacity. Secondly, it's giving you something to do every hour. So instead of thinking about the HRCT score, it's better that you talk about your breath holding time, which is a positive things to do. Now, the most important value of this video will come in the post-COVID recovery. So what will happen, all those who have had moderate or severe involvement of the lung because of pneumonia, when this heals, during healing, there may be tendency for that areas to shrink, which is what we call fibrosis. So typically, if you look at my hand, what fibrosis will do, if this is the size of the normal lungs, fibrosis will tend to shrink.
Shrink the lungs.
Now,
That's right.
How do we stop this from happening? By mechanically opposing it and making it like this. And
through
how
the
do we do
exercises.
that? If you take a deep breath in, and hold it for as long as you can, you are actually opposing this. So lung is doing this and you are doing this, and this battle will go on for 6 months, because that's the time it takes for the body for the healing process. So my recommendation to everyone who has had moderate or severe disease is to please do these breathing exercises. And trust me, if you can take your breath holding time to 30 seconds plus, there will be no fibrosis. I assure you that.
Right. Okay. Okay, doc. So the next question actually was around fibrosis. So you were already, answered that. Okay, from Ankit, what's the typical protocol and timeline for a healthy lung recovery for a patient with around 80% lung involvement? And is X-ray the correct measure to monitor progress? I think that understand CT scans are quite harsh on the body. Should the patient move under a pulmonologist care after infection, COVID infection has gone down? And this is from Ankit.
So my advice to everyone is that please do not treat the CT scan. Please treat the patient. Everybody, instead of worrying about patient, when people come to me, sir, my CT score is 20 by 25. I said, don't talk about CT. Tell me patient. Sir, patient is all right. He's on only 1 liter or 2 liters of oxygen. He's sitting comfortable. But sir, my CT score is 20. I said, let's not talk about CT. So my humble appeal to all of you is patient condition is most important. If patient is off oxygen, let me tell you, somebody with a diseased lung, pre-existing disease, and a CT score of 6 by 25 may be more breathless than someone who has a very healthy lung and now has a score of 16 by 25. Right. So it's a lot of factors. Plus, the CT score is a one time. You did it today. It was 16 by 25. 3 days later, it may be 24 by 25, or it may be 8 by 25.
It's a static image. It's a static picture.
One-time value. One time. It changes. Whereas clinical situation is a real-time dynamic value. So trust your oxygen. Trust how you are feeling, whether you have fever or not. Appetite is a very strong indicator. If there is good appetite, improving appetite, it's a message from the body that everything is good.
You're on the path to recovery.
Absolutely. No fever, good appetite, you're feeling all right, your saturation is all right, you're not having any chest pain, you're able to breathe well. And if you go on breath holding time schedule, if you're able to add 2, 3, 4 seconds every day, and the day you cross 25 to 30 seconds, you are in the green zone. Please stop bothering about CT score. Your saturation, your pulse rate, saturation, if it's more than 94, I'm fine with it.
Okay, doc. So doc, and everybody says that actually lungs, I mean, you do transplants as well. So have you seen is COVID causing any lung transplants to happen? Is there any correlation?
No, there is a serious problem with lung transplant for COVID patients. Liver and kidney transplants are done mostly about 70-80% of the activity is live related, where a relation donates the blood. 10-20% of the activity is from cadaveric, the brain dead donors.
Live donors, that's right.
Because donating one kidney or donating half of the liver does not affect the life of the donor.
Right.
Unlike that, if you give one lung, it reduces the life of the donor by 5 to 10 years, and hence it's not allowed by law. So if I have to do lung transplant for a COVID patient, the lungs have to come from brain dead donors who are typically seen in the ICUs, most of the time road traffic accident victims. And these days, most of the ICUs only have COVID patients and none else. And therefore, lung transplant cannot be a viable option for thousands of patients who are actually going to develop lung fibrosis. So I get about 8 to 10 calls every day from all over the country about this, but this is not a viable option for a COVID-induced injury.
Okay, so because it's also not a regenerating organ like a liver or something, right?
It doesn't regenerate like liver. The best regeneration comes in the liver. Very well said, Bhavna.
Thanks, Doc. A bit too close to home. But okay, Doc, from Rakesh. Hi, Doc. I'm 64, have diabetes, hypertension, and rheumatoid arthritis and weight issues. having been vaccinated fully a month ago, had a score of 29 on the RT-PCR 2 weeks back, and took no steroids, but only Dolo. So what are your views on that, Doc?
How many days post RT-PCR are you?
Well, that, Doc, I'm reading from the from an audience question.
So you know, if he has completed about 10, 12 days time and he's doing fine. So first of all, let me also tell you that this RT-PCR CT value, it's called cycle threshold value, which everybody is crazy about. Oh, mine is so much. How much is yours? This has no relevance. It has no relevance to the severity. People say if your score is high, that means less infection, score is low. It has no value. Again, it's a one-time static value. Suppose today my virus was not multiplying when I gave my RT-PCR sample. Tomorrow it is multiplying factor. I will be carrying my today's report, but tomorrow my situation may be different. Please, the CT value and the RT-PCR CT value, both these are one-time static value. The RT-PCR CT value has no role. I don't know why they write it. They should not be writing it. The CT value gives you a one-time reading, but that reading may change in the subsequent days for the better or for the worse. So clinical condition of the patient is most important.
I think one of the things that people underestimate, Doc, is that, you know, blood work is one thing. Your HRCT is one thing, but clinical examination, I think if the person is walking, happy, you know, in good spirits, appetite is going up, I think we can really, you know, say that they're on the path to recovery. And I think message of hope is important.
Unfortunately, in this COVID pandemic, the clinical medicine has been pushed to background and it's been overtaken by people doing self-blood tests, self-HRCT scans and measurement and treatment also on the self basis, which is wrong. Clinical medicine is most important.
Right. Okay, Doc, we've got from Neha, what's the role of paracetamol if I have COVID? I think you've already covered this, that if somebody has 99, 100, yeah, we can just move on. Sarika is asking, can we take ivermectin as a precautionary medicine?
Yeah, I take it. I take it. Not now, because now I'm post-COVID. So at least for 3 months, I have antibodies. So currently I'm not taking it, but till the time I had got vaccinated before that, during the whole of last year's pandemic, I took 1 tablet once a week, and my wife, my family, my whole unit, everybody was taking it. There is a study from AIIMS Bhubaneswar where they compared healthcare workers, 2 groups, one group which was given it, one group which was not given it. And they said that the incidence was much less in the group which was given it, although other people have challenged this study on technical grounds. So evidence is weak, but again, it's a safe medicine, deep medicine. If you take it 1 tablet once a week, it will do no harm, may do you good. But most important for preventing COVID is COVID appropriate behavior.
Yeah, the behaviors I think are really important, and all the hygiene and, you know.
Let me just explain, there are 4 pillars of this behavior, 4 pillars now. One is mask, which today, yesterday, the principal scientific advisor to Government of India has issued fresh guidelines, and they have heavily recommended double masking, which should be a surgical mask and a cloth mask combination. The inside one should be surgical mask, worn properly with covering or pressing of the clip so that there is no air going from the side. The outside one should be cloth mask. If you don't have surgical mask, then the next best is to have 2 cloth masks, double layer cloth mask. Ideal is N95, which gives you 95% protection. So this is one, masking, 2-meter distance, social distancing. And third, very important, which has not been talked about so much, is people collecting in closed spaces. So they have said that the droplets tend to fall at 2 meters, but the aerosol tends to go up to 10 meters. And if you are in a closed, unventilated room, it tends to stay there for many hours, and people who come and sit there and breathe there are likely to carry it. And therefore, opening the windows, opening the doors, having exhaust fans, a very well ventilation is vitally important. So this is third. And fourth, of course, is hand hygiene. Mask, social distancing, not collecting in closed spaces, and hand hygiene. These 4 will continue to be the pillars of COVID management during 2021.
Right, absolutely. Well said, Doc. It's a really good reminder for everybody. Okay, and from Zia, is extreme exhaustion several days after recovery indicative of a lung issue?
No, it's not indicative. In fact, I'm grateful to Zia that she raised this issue of post-COVID recovery. So there was a study recently which looked at people who had recovered from COVID, mostly moderate and severe symptoms, and they found that nearly 75–80% of the patients were having some complaint of the other. This could be psychological problems, memory issues, emotional issues, depression, etc., etc. It could be throat issues, chest issues, tummy issues, weakness, exhaustion, fatigue, lots of issues. Good diet, positive thinking, and regular monitoring of your oxygen and heart rate. These are three vital pillars. Everybody loses weight during COVID, so good diet is important. Positive thinking again is important.
Absolutely.
Exercises are important. If your doctor has given you medicines for diabetes, hypertension, etc., please take it and monitor your oxygen and heart rate regularly. Remember, time is the best healer, and as the time passes by, the good news is most of these problems heal in due course of time.
They will get better. Doc, we're going to have to make this really short and sweet because we're already over time, and I know that, but we're just going to keep on taking the questions really quickly. From Deepak, if fever and cough persist from second day when CT scan of lung, when is the CT scan of lungs recommended?
Yeah, so typically if you have fever and not much of symptoms, maybe mild cough, your respiratory rate is all right, your 6-minute walk test is okay, everything is also okay. First week, there is no indication for this. But if you have excessive cough at any point of time, if you have, say, severe chest pain, if your breathing rate goes above 24, if your 6-minute walk test shows fall in saturation, or your saturation falls below 94, even before 7 days, these are all indications for doing this. If your fever persists into second week, then I would say in the beginning of second week, you should go for HRCT as well as blood test, because then you may be, especially if you're suffering from these numerous comorbidities or are 60+. But an uncomplicated first week, there is no reason for it.
Sure, Doc. So basically day 6, day 7, right, is about the right time, because that also helps manage the disease, right? The doctor manage the Okay, from Aarti, in the case of a moderate infection where steroids have been used, tapered and stopped, have you heard of mild fever? And this is after 2-3 weeks of being COVID negative. What are the possible reasons and what tests are suggested, Doc?
So it depends on what is your definition of mild fever. I was COVID positive on 5th of April. I was in isolation, home isolation for 2 weeks. I was post-vaccine, so it was a mild disease. And after that, I started my work. I did have some leg pain complaints and all, but mild fever, particularly 99.2, 99.4, persisted towards the evening for about 3 weeks. It's only last week that the fever disappeared. So this kind of mild fever, if there are no other complaints, as I said, how you are feeling and how's your appetite. These are two very vital signs.
Awesome,
so mild fever probably will settle in time, but if you have feeling of unwell, if you have other problems, then you must see doctor. There is a long list of problems which I can't enumerate here, but you must see your doctor.
Awesome, Doc. You're really rocking it. Thank you. From Renu, doctor, you touched on blood thinners and EcoSprin. I did not understand clearly. So basically, she just wants to know, when are blood thinners a must?
Moderate and severe disease, blood thinners are a must. In the hospital, they are given in injectable form. And when you are discharged from the hospital, those are converted to oral form, which typically in an uncomplicated case is recommended for 10 to 15 days. But if you have had any clotting issues during the hospital stay, which has been documented, then we give it for about 3 to 6 months.
Awesome. From Radia, my daughter 7 years, my son 3 years, had corona recently, the second wave. It's all over the news for a third wave for children under 12. Do they have immunity or are they still at risk?
Yeah. So last year's COVID first wave affected only the 60+ people. If you recollect, most of the deaths were in the 60+ age group. Very strangely, this current strain has affected 30 to 45 population. Majority of the involvement and deaths have been in this group. And it is being apprehended that next wave may affect mainly the children. Reason, 18+ population now is heading towards vaccination. But as of today, less than 18 is still not vaccinated. So say 2 months down the line, if the virus was to come back for the third wave, which is the most susceptible population it will find? The children.
Yeah,
because they
absolutely.
will be unvaccinated. So therefore, there is a strong need for trials to be done and vaccines to be opened for children. In US, they have already opened for 12 to 18 age group,
yeah.
and they are doing trials in the 2 to 12 age group. Now, the same thing needs to be done on an urgent and fast forward mode in our country also, so that before the third wave, we have our children vaccinated.
Okay, awesome. From Shibani, do you believe that an antibiotic cover should be given when you start oral steroids on day 6, if the treatment is being done at home? And also, do you believe in a double dose of 24 mg a day of ivermectin for 3 days?
No. Double dose. See, extra dosing will not give you extra protection, but may increase the chances of complications. So there is something called physiological dose. If you go from physiological to pathological or lethal dose, the benefits don't improve, the side effects improve. Don't do that. And secondly, if you are taking steroids at home, yes, it makes sense. I think it's a very sensible proposition to cover it with antibiotics. We do the same in moderate to severe cases in the hospital as well.
Right. Okay, that's great. Doc, if medicines like remdesivir, etc., are not available, including hospitals, why are doctors recommending it for patients? Are there no alternative salt sources? From Sonali.
Yeah, so remdesivir is an antiviral, and initially it came with a lot of fanfare. It was initially discovered for Ebola. It's a repurposed drug for COVID. When the WHO conducted the trial, they found that it was not making any difference in the outcome for mortality, no difference in the ICU, other things. The only difference was length of ICU stay reduced from 18 days to 11 days. That was the only gain. But people have been writing it. If you look at the ICMR guidelines or AIMS guidelines, again, remdesivir is mentioned in extra, may be given, not in the mandatory category. So two things which are really vital and make a difference to the outcome in moderate severe is oxygen and steroids and blood thinners. These are three. Remdesivir does not make too difference in the death rate. Now, why people are writing? If I was to advise, I will tell, okay, if it's available, we can use it. If not, don't run around. There is no need to stand in a one kilometer long queue and expose yourself in the queue just waiting, because it's not going to make outcome difference. If your patient has to survive, he will survive without remdesivir, and similar vice versa.
Okay, and now the last question for the night from Deepak. What recommendation about opening the windows? So if a COVID patient is your neighbor, should you open your windows, I guess is Deepak's question.
It depends on how close is your window to his window. Now, let's forget the neighbor. It's a very important point he has raised, because the yesterday's scientific advisor guidelines also have mentioned. In fact, they have gone to the state of villages, that in villages, if you have a jhopadi and it's closed from all the sides, you make a small hole on two opposite sides and put some jali to allow cross ventilation. So what is important is, see, if I'm a positive person and Bhavna, you are the normal person, we are both sitting in a room. If I'm not wearing a mask and I speak, cough, sneeze or sing, whatever, my aerosol is coming out. It's going to 10 meters. If you are not wearing mask and sitting in that 10-meter distance, all my aerosol is going to you. You have a very high chance of getting the infection. Suppose we have a very high speed exhaust in that room, which is throwing out that aerosol. Two of us sit together for 1 hour in that room, but most of the exhaust is thrown out. You have much lesser exposure, much lesser dose exposed. If I'm wearing an N95, which gives me 95% of the droplets are stopped, you are exposed to only 5% of my droplets. If you are also wearing a mask, even 95% of that 5% is preventive. So masking is important. Ventilation in the rooms is vital. When you sit in rooms, keep the windows and doors open. In fact, the scientific advisor has recommended that even in air-conditioned rooms, please keep the windows and doors open.
Wow.
I'll share that PDF with you after this.
Please do, Doc. That'll be fab.
Sure.
Doc, I want to say a huge thank you to you for coming on Need of the Hour today. It has been an absolute privilege to have you. You're doing such amazing work. You've been, making these videos and sharing them, and even today, I mean, such wonderful protocols. And more than anything, you're leaving everybody with I love your statistic: 98% recover. So let's just hold on to that hope, and really just keep that hope alive. Keep your mindset. Doesn't matter, you will overcome it. I know that everybody's facing different things, but Doc, your message is really, really important at this time. So really a big, big, big thank you from all of us at CII IWN, as well as CII, as well as our audience. Thank you so much, Prof. Arvind Kumar. Thank you so much.
Thank you. And all of you have a wonderful evening.
Thank you so much. And everybody, please do join us on Monday for Need of the Hour. We are closing our series on June 1st with Sister Shivani. Good evening, and we'll see you back on Monday. Thank you so much.